Everyone, and thanks very much for joining us this evening. I'm Claire. I'm one of the archivists on the Barts Health Archives team. Before we begin, just a few items of housekeeping. Our speaker tonight will be talking for about 35 or 40 minutes, and then there'll be a chance for you to ask questions. So please type your questions into the chat box throughout the talk. And you'll see that at the bottom of your screen, there should be something called chat. So if you just use that to type in your questions, and then my colleague Dan will collate them and put them to Amy at the end of the talk. Just to let you all know that tonight's talk is being recorded and will be made available afterwards on our YouTube channel. So you'll be able to watch it again if you want to, or pass the link on to anyone who couldn't make it along tonight. This is the third in our series of free online talks, which aims to showcase the breadth of collections held at Barts Health Archives, and also to highlight the diverse work of our researchers. For those of you who don't know, just a brief introduction to our service and what we do. Barts Health Archives are one of the largest hospital collections in the UK, and is among only a handful of archives managed within a hospital trust. We hold records dating from 1137, shortly after the foundation of our oldest hospital, St Bartholomew's, to the present day, including records of over 30 hospitals within the City and East London, as well as material relating to various charities, organisations, institutions and individuals related to healthcare and training. And while many of the hospitals for which we hold records no longer exist, the Royal London Hospital, which you're going to hear about tonight, is very much still alive and well and represents one of our largest and most significant collections. And I'm sure many of you attending tonight will have an interest in the built environment. So you might like to take a look at our new research guide on this subject, which is part of a series of guides that we've launched on our website yesterday. And I'll include the link to that in the chat box in a moment. So without further ado, it's my pleasure to introduce tonight's speaker, Amy Spencer. Amy is an architectural historian working on the Survey of London, based at the Bartlett School of Architecture at University College London, where she's also a doctoral candidate. The Survey of London is renowned for its long-standing series of volumes exploring the history of London's built environment. Amy has researched the Royal London Hospital for the survey's forthcoming volumes on Whitechapel, which will be volumes 54 and 55, and these are expected to be published next year, 2022. So Amy, I will ask you if you're ready to hand over to you now, and please ask you to start sharing your screen. Thank you.
Thank you to Claire, Dan and Kate for inviting me to talk about my research today. It really is a pleasure to contribute to this series of talks. I'm going to talk for about 40 minutes, leaving 15 minutes or so for questions. I will start by introducing the Survey of London and our study of Whitechapel before focusing on the Royal London Hospital. I would like to take this opportunity to thank the Archives team for their help and support with this research from 2016. During this talk, my aim is to draw up a wide range of records that was used at Barts Health Archives and Museums to research the Royal London Hospital and its estate, providing an insight into the survey's approaches in Whitechapel. The Survey of London is the leading reference work on the history of London and its buildings. The survey was established in 1894 by Charles Robert Ashby, the arts and crafts architect, designer, and social thinker. Initially a small volunteer project, the survey has evolved into a detailed area-by-area chronicle of urban development, covering buildings of all types and periods. Since Ashby's day, the survey has published 53 parish volumes and 18 monographs, exploring a wide variety of London districts, most recently South East Marylebone and Oxford Street. All kinds of buildings are illustrated, analysed, and set in the context of each area's development, demography, and social and economic history. Since 2013, the survey has been based at the Bartlett School of Architecture, part of University College London, where it continues its research today. We are currently a team of 7, with 6 historians and an architectural illustrator. If you would like to learn more about the survey, its history and work, please visit our website. We have recently produced a short film about the survey too. Links to these resources will be shared in the sidebar. In 2016, the survey launched a study of Whitechapel, a district at the core of the East End with a long and rich history. There is currently intense and rapid change in the area due to its proximity to the city. This map shows the Whitechapel study area, which extends from Brady Street and the Royal London Hospital at the north and east to Wellclose Square and Mansell Street at the south and west, taking in well-known buildings such as Whitechapel Bell Foundry, Wilton's Music Hall, Altab Alley Park, the Whitechapel Gallery, and the East London Mosque. As part of the project, an interactive website was created in collaboration with colleagues at the Bartlett Centre for Advanced Spatial Analysis, with a grant from the Arts and Humanities Research Council. The website was an experiment in the public co-production of research, tapping into the insights of local communities and others to document experiences and knowledge of buildings and places in Whitechapel. The project is now reaching its completion, with the publication of 2 volumes on Whitechapel expected in 2022. For more information about the survey's Whitechapel study and to explore our research in the area, please see our website, surveyoflondon.org. We'll share a link in the sidebar too. In Whitechapel, my focus has been the Royal London Hospital and the portion of its estate lying on the east side of New Road. This area is bounded by Whitechapel Road at the north, Cavell Street at the east, and Commercial Road at the south. This part of Whitechapel has been shaped by the development and expansion of the Royal London Hospital, or the London Hospital as it was known before 1990, one of the capital's largest teaching hospitals. For this work, the main repository for historic records was the archives of the Royal London Hospital, just one of the many institutional collections held by Barts Health NHS Trust. This map shows the study area in 2015. At the north end is Whitechapel Road, with rows of shops and other buildings hemmed in by railway lines connecting to Whitechapel Station. The historic premises of the Royal London Hospital extend along the south side of Whitechapel Road. This building is currently undergoing adaptation and remodelling to provide a new town hall for Tower Hamlets Council. In 2012, the hospital transferred to a modern tower block at the southeast of its historic base, its first move in 250 years. In the following slides, I will retrace the history and development of the hospital from the 18th century to the present day, drawing on the use of archival sources. The Royal London Hospital traces its origins to an infirmary founded in 1740. This institution was the first charitable hospital set up on the east side of the city and originally intended for the relief of merchant sailors and labourers, along with their wives and children. A house was initially leased for the infirmary in Featherstone Street near Moorgate, shown here on Roke's map of 1746. The infirmary quickly started searching for a larger house in a more convenient location. By April 1741, a house was leased on the south side of Prescott Street in Goodman's Fields, shown here towards the centre of the map. This location was judged to better serve the charitable interests of the hospital due to its proximity to the dwellings of Spitalfield labourers and merchant sailors near the Thames. A shop in nearby Ailey Street was used for an apothecary store, and in 1742, another house in Prescott Street was leased to accommodate isolation patients. By 1743, the expiration of the lease at Prescott Street was looming, and the infirmary needed more space. A building fund was opened to collect donations towards a purpose-built hospital. In the short term, the infirmary continued to lease the existing house in Prescott Street, along with 3 adjoining houses and a building at the end of the garden. In 1747, the hospital appointed a committee to search for a suitable piece of ground on the east side of London, asking them to proceed with great management, secrecy, and expedition. By the following year, the hospital surveyor, Bolton Mannering, had earmarked a site on the south side of Whitechapel Road. This largely open site was well positioned to answer the charitable aims of the hospital, being near to the workplaces and dwellings of its nominal patients, and at a distance from any other hospital. Negotiations over the acquisition of the site were complicated, but eventually settled in 1750. For this part of the research, I referred to the minutes of the weekly meetings of the House Committee. The early minutes are in manuscript and bound in large volumes, starting in 1741 and going up to 1948. The minutes contain detailed and fascinating insights into the workings of the hospital, including decisions about building works and alterations. Due to the lack of a complete index, my approach towards the early minutes was to work through the volumes page by page and transcribe relevant minutes to build up a picture of decisions about the hospital and the search for a new site. It was possible to extend these findings by turning to the minute books of the General Court or the Court of Governors, which run from 1740 to 1953. In 1751, with the site on the south side of Whitechapel Road now in hand, Mannering was asked to draw up plans for a new hospital. A building committee specified that the hospital should accommodate 200 patients, with provision for further enlargement. After several proposals, the committee selected a design for a plain hospital with a U-shaped plan, comprising a 3-story central block and 2 rear wings. The north front of the hospital, facing Whitechapel Road, was to have a plain, symmetrical facade with a central pediment. The successful design was publicised in an engraving by John Tinney, commissioned to be executed with all expedition to attract donations and to reassure supporters that there was nothing, quote, ostentatious, sumptuous, or unnecessary intended. As well as an elevation drawing, Tinney's engraving included plans of the ground and first floors. On both levels, the central block contained a spine corridor and 2 large wards positioned on the south side of each floor, considered to be the most favourable aspect for patients. On the ground floor, the north side of the central block was occupied by offices for the apothecary, physicians, nurses, and stewards. The first floor had a large central room which served as a chapel and a space for holding general courts. The rear wings contained back-to-back wards, accessed via lobbies containing sinks, privies, and nurses' rooms. In 1752, the landscape artist William Bellers presented an oil painting of the prospective building to the Infirmary. The painting shows the hospital from the northwest, on an open and spacious site surrounded by fields. Medical staff prized this semi-rural location for its healthy properties, especially its airiness. As it was widely believed that disease was spread by foul air or miasma, the quality and circulation of air was perceived to be essential for the recovery of patients. The painting presented an idealised view of the hospital site, which wasn't quite so isolated. For instance, we have already seen that there were some buildings at the east of the hospital site on Roke's plan of the 1740s. An engraving of 1753, based on Bellers's painting, shows Whitechapel Road in the foreground. This main arterial road provided access to the city for the hospital's governors and consulting medical staff. On the right-hand side is Whitechapel Mount, an artificial hill which was formed in the 1640s and only cleared in the early 1800s. The central block of the hospital was built first and occupied from 1757, with room at first for 130 patients. The east wing was built from 1771 to 1774, followed by the west wing from 1773 to 1778. By this time, the hospital contained 215 beds. This has only been a brief overview of the early history of the hospital, but if you are interested in reading a more detailed account, please have a look at my article in the Georgian Group Journal, published back in 2017. We will share a link to a PDF version, which is freely available through the Georgian Group's website. The hospital wasted no time in establishing greater control over its vicinity. The new building overlooked a stretch of fields and pastures that belonged to the Red Lion Farm at Mile End Green. The charity acquired a moiety of the estate in 1755 when the central block was still under construction. The other moiety was secured in 1772. Crucially, the acquisition of this large landholding protected the hospital from encroachment and unwanted development. The hospital surveyor was soon asked to prepare a plan of the estate. That plan, produced in 1783 by John Robinson, survives as an important record of the estate prior to building development. At the top left-hand corner, a cartouche contains a charming perspective view of the hospital and its medical school, which was about to be built in a single-storey range adjoining the central block. Here is the same plan, only rotated by 180 degrees to show the hospital at the north. Fields and pastures reach southwards to Whitehorse Lane, later Commercial Road, divided by the north-south course of New Road, which had been formed in the 1750s. The eastern boundary of the estate followed the uneven course of a ditch, coinciding with several small ponds. Soon after this map was produced, the hospital began intensive leasehold development to improve its income, which was otherwise reliant on donations and subscriptions. At first, building development was concentrated on the west side of New Road, well away from the hospital. From 1800, the easterly fields were gradually covered over with dwellings arranged in a grid of streets, spaced widely in an attempt to preserve air circulation. The eventual street layout is shown on a plan of 1855, produced by the hospital surveyor Alfred Richardson Mason. This plan also shows the footprint of the hospital at the bottom and Commercial Road at the top. Once rotated, it is easier to understand the street layout in relation to the estate plan drawn up by Robinson in the 1780s. The west side of the estate, which was the first part to be developed, was divided into long rectangular blocks orientated north-south. On the east side of New Road, the estate was organised into a grid with smaller blocks, which increased street frontages and rental yields. The importance attached to air circulation is shown in the retention of open spaces immediately south of the hospital. The hospital retained strict controls over the quality and nature of building work. The brick houses were generally of conventional terraced form, often with raised basements. There are survivals from this original phase of development today. For instance, here is a row of 6 houses on the west side of Turner Street, built from 1809 to 1814. There are more surviving houses on the west side of Philpott Street, a broad street behind the hospital that was intended to be superior to the cross streets, with larger terrace houses set back behind forecourts. These particular terraces were built from around 1838 to 1844 and were among the largest and best houses on the estate, with a greater level of refinement in their decoration, such as fanlights and fluted door surrounds. This part of my research was supported by the survival of a detailed schedule of leases that was drawn up by Mason in 1855. This bound volume contains the plan of the whole estate, which we saw earlier, along with plans of each block. For example, here you can see what was referred to as Block N, located at the southeastern boundary of the estate, adjoining Commercial Road. The block plan is accompanied by a written schedule containing lists of each lot or property with useful information, such as the date of the original lease, the name of the first tenant, the term of the lease, and particular conditions tied in with the covenant. A final column, titled Remarks, contains notes, annotations, and revisions that were added to the schedule into the 20th century, revealing changes in use and ownership over a long period of time. Mason also produced a volume of drawings and plans of the hospital, which dates to 1832. These drawings were prepared in connection with plans for the first major enlargement of the hospital. Rapid population growth had resulted in a rising number of patients, and Mason suggested extending the east and west wings to provide new wards. This block plan presents a proposal for the hospital's grounds, showing a central patient's garden bordered by the hospital and ward wings, an enclosure or burial ground at the south, and a forecourt at the north. A private garden, perhaps for hospital governors, was located at the west side of the hospital, while the east side was given over to practical uses, such as a drying ground for laundry. This ground plan shows more clearly the size and layout of the wing extensions. Mason added a block of ward lobbies, leading to another range of back-to-back wards. The west wing was built from 1830 to 1831, while the east wing was delayed due to a lack of funds and eventually built from 1840 to 1842. The additional space enabled the hospital to provide separate wards for Jewish patients for the first time, an improvement that lasted only briefly until 1854 due to the demand for space. The hospital was increasingly inundated with patients. By the 1860s, more than 30,000 people were being treated as inpatients and outpatients each year. Overcrowding was not confined to the wards, as medical officers and nurses endured cramped conditions with little promise of rest. By 1862, the situation had become untenable, and a report on overcrowding presented to the House Committee pronounced, quote, a very serious defect in the arrangements of the London hospital. The solution was to build a substantial new wing, extending the hospital west along Whitechapel Road. This extension was designed by Charles Barry Jr., who was by this time the hospital's surveyor. The wing provided space for about 70 beds and separate wards allocated to children, obstetrics cases, and Jewish patients. The wing was built from 1864 to 1866 and named in honour of Alexandra of Denmark, who had recently become the Princess of Wales. Here is a plan showing the basement of the Alexandra wing. The wing was divided broadly into two parts. A residence was provided at the west end for the house governor, who managed the daily workings of the hospital and its expenditure. The rest of the basement housed a surgical outpatients department with a large waiting room and smaller rooms for consultations, dressing injuries, and dispensing medicine. The wing also included attic dormitories for night nurses, addressing concerns about lack of supervision and living out. The intermediate floors were given over to wards, with the exception of a committee room on the ground floor, which you can see in the photograph here. It is just possible to spot the painting presented by Bellers in 1752, displayed in pride of place above the mantelpiece. In the 1870s, the hospital expanded eastwards with the construction of the Grocers Company's wing. The new wing secured the London hospital's status as one of the largest general hospitals in the country, with almost 800 beds. This illustration shows the north front of the Grocers wing, set behind Whitechapel Road. Once again, the extension was catalysed by increasing numbers of patients, with Charles Barry Jr. as consulting architect. The building was named after the City Livery Company in recognition of a donation towards its construction. This illustration was found in a scrapbook of press cuttings to commemorate the visit of Queen Victoria to formally open the Grocers wing in 1876. A sentimental scene of the Queen greeting a child is surrounded by portraits of individuals connected with the hospital, such as the treasurer, house governor, senior surgeon and physician, and the architect. The scrapbook also includes more illustrations from newspapers, such as this view of a Sunday morning service in the chapel of the hospital, showing patients sitting and standing where possible in pews. The scrapbook also contained street scenes showing the celebrations along Whitechapel Road for the royal visit, such as this illustration of the royal carriage arriving at the hospital, surrounded by flags, banners, a military guard, and spectators. The illustration also offers a good view of the north front of the hospital at the time, showing the Alexandra wing, the central block, and the Grocers wing receding into the distance. Between 1890 and 1906, every part of the hospital was extended, rebuilt, or remodelled under the supervision of the architect Roland Plum. This ambitious building programme upgraded the hospital in line with shifting ideas and innovations in healthcare. The front block extension, built from 1890 to 1891, improved the practicality of the main building while creating a dignified public entrance. A 5-bay arcade provided a porte cochere for horse-drawn ambulances and a central stepped entrance for pedestrians. The first floor was occupied by a chapel with round-arched traceried windows. At the same time, the hospital embarked on a programme of sanitary improvements prescribed by Dr. Louis Parkes, a hygiene expert at University College London. The old brick sewers were replaced by a new drainage system, and sanitary towers were built on the east and west wings to isolate baths, water closets, and sink rooms. The front block extension and sanitary improvements were just the first components of Plum's building programme. The works intensified between 1899 and 1905, when each part of the hospital was remodelled and extended. The main range was underpinned and its walls strengthened in preparation for 2 new stories. The 3rd floor extension secured a new operating department with a large theatre for teaching demonstrations, 4 operation rooms, and adjoining anaesthetic rooms. The number of operations at the hospital had increased significantly, partly due to the use of anaesthetics from the 1840s, and the former provision of just 1 operating theatre in the attic was inadequate. This photograph shows one of the operating theatres, not the main theatre, but a smaller one behind the front block, in around 1903. The space was bright with plenty of natural light due to the extensive north-facing windows and skylights. A portable tiered scaffold provides space for medical students to observe operations, while there are wheeled trolleys for dressings and equipment. The walls are lined with tiles and the floor is covered with terrazzo, both smooth, impermeable surfaces which could be cleaned easily. These decorative finishes reflected a growing focus on cleanliness and hygiene, encouraged by Florence Nightingale's work from the 1850s and the acceptance of germ theory from the 1880s. These alterations to the main building were carried out in parallel with the construction of purpose-built, detached buildings for specialised departments. An example is the outpatients department in Stepney Way, a substantial block built from 1900 to 1902 to replace outdated and cramped outpatients departments in the basement of the Alexandra Wing and the West Wing. This map shows the hospital site around 1919. As you can see, the footprint of the hospital had expanded significantly since the 1870s. The main hospital building, shaded in orange, now only represented part of the institution. In purple, you can see the detached blocks that were built for specialised departments, such as the outpatients department, an isolation block, a laundry, and a post-mortem department. At the southeast of the main hospital site, shaded in green-yellow, is a series of nurses' homes. The nurses' homes are partly visible on the far left of this photograph, which shows the quadrangle behind the central block of the hospital, looking directly south. At the centre of the quadrangle was a bronze statue of Queen Alexandra, who was president of the hospital from 1904 to her death in 1925. The improvement of health, respectability, and discipline among the nursing staff provided the main impetus to build residences on and adjoining the hospital's grounds. Eva Luckers, the hospital's matron from 1880 to 1919, insisted on the provision of individual bedrooms for nurses and sisters. During her long incumbency, the number of resident nurses increased significantly. The 1881 census recorded 87, while the census of 1911 counted 446. Covered bridges extended between the tall blocks of the nurses' quarter to ensure safety, convenience, and protection from bad weather. The nurses also gained several amenities for leisure and recreation. Their homes contained sitting rooms, libraries, and dining halls. For example, here is a view of a sitting room in the Eva Lucker's home around 1910. In 1898, a public garden in Stepney Way was acquired for the use of the nursing staff, who referred to it affectionately as the Garden of Eden. I'm going to move on now to the hospital's development for the rest of the 20th century, but if you'd like to read a more detailed account of Plum's energetic and extensive building programme, please have a look at my article in the London Journal. We will share a link to a free version of the article in the sidebar. Few alterations were required for some time after Plum's work. This aerial view of the hospital, shown from the northwest in the 1930s, provides an indication of its size and the continuity of its work, with the hospital described as a small town, awake almost around the clock. In 1938, a bicentenary campaign was launched to fund a programme of repair and reconstruction. The building works overseen by Plum were still commended for their solid construction and spacious planning, but the hospital required new departments to pursue advances in medicine and healthcare. This fundraising pamphlet sets out the hospital's aspirations, including new clinical laboratories, a new wing for a casualty and fracture clinic, and a dental department, while setting out the shortcomings of the existing buildings and spaces, with lots of interesting photographs. The bicentenary programme was in the end abandoned due to the Second World War, which brought serious challenges. The hospital was plunged into coping with casualties, while patients, staff, and students were evacuated to hospitals and outposts beyond London. The hospital surveyor, Norman Oakley, started to prepare the building for war, converting the matron's office and a ground floor ward into emergency operating theatres, and setting up air raid shelters, among other measures. The number of beds was reduced to 180, while another 200 beds were held in reserve. In late 1940, the Alexandra Home, the Eva Lucker's home, and the medical college were hit by bombs. Severe destruction was evaded until August 1944, when the East Wing was damaged by a V-1 flying bomb. The hospital emerged from the war in significant debt, with small hope of repairing bomb damage and carrying out improvements without state assistance. In 1948, the establishment of the NHS brought the hospital under state administration. Two ambitious rebuilding schemes were mooted after the war. The first, drawn up by Adams, Holden, and Pearson with Norman Oakley in 1946, was not implemented due to a lack of funds. The second, by T.P. Bennett and Son, was drastically curtailed in the 1970s by the listing of the hospital. In the event, alterations and additions were carried out gradually. The upper stories of the East Wing were rebuilt from 1958 to 1959, followed by a 5-story extension of the West Wing to provide additional wards. The quadrangle between the East and West Wings was partly sacrificed for the link block, built from 1959 to 1962, providing wards and kitchens on the top floor. At the same time, the accommodation for the nursing staff was extended by the construction of Knutsford House, built from 1956 to 1957. This block provided self-contained flats for sisters, each with a bedroom, a living room, a kitchenette, and a bathroom. This is an extract from the Nursing Times, which provides a fascinating insight into the living conditions, and a sales pitch, peace and privacy in a newly built block of flats off the Whitechapel Road. At the southern end of the hospital's estate, Bennett and Son also designed John Harrison House, a 10-story tower block built in the 1960s. This block contained around 220 bed sitting rooms for female staff, principally nurses, administrative staff, physiotherapists, and technicians. Nurses' homes were also built in Philpott Street, Ashfield Street, Garden Street, and Turner Street, all conveniently located for the recently completed Princess Alexandra School of Nursing. The 1960s also saw the construction of an extensive block for the Dental Institute, and the Students' Union in Stepney Way. The east side of the block was occupied by the Students' Union, which had a dining room, common rooms, music and games rooms, while the other side was devoted to dentistry, combining treatment, education and research. This photograph of a laboratory in the Dental Institute is from a folder of photographs in the archives, where there are also leaflets, brochures and official files which provide an impression of the building and its spaces. This plan of the first floor, as it was in 1965, soon after the building opened, emphasises the division between spaces, with the Students' Union at the east and the Dental Institute at the west. The drawing is based on a plan from a large collection of aperture cards at the archives, which cover buildings across the hospital and its estate in considerable detail. This aerial view shows the London Hospital and its estate in 1969, emphasising the expansion of the hospital southwards across its estate. The original brick-built terraced houses are interspersed with large institutional buildings, nurses' homes of varying scales and architectural styles, a students' hostel and educational buildings, and several hospital blocks. The extensive footprint of the hospital recently contracted with its transfer in 2012 to a new tower block. The former hospital is currently being refurbished and extended as a town hall for Tower Hamlets Council, while other disused hospital buildings, such as the outpatients department and the Dental Institute, currently lie vacant. The new hospital was built from 2007 to 2012, occupying the site of the east wing of the main hospital building and the nurses' homes. The rebuilding plans developed from the merger in 1994 of Barts, the Royal London and the London Chest Hospital. The new hospital, designed by HOK International, comprises 3 towers, the highest rising to 19 stories. The roof of the central tower is capped with a helipad and a unit for the helicopter emergency medical service, or the London Air Ambulance. In 2019, the hospital contained 675 beds, arranged over more than 100 wards, and 26 operating theatres. The 14th and 15th floors were initially left unoccupied and unfinished to reduce costs, but the COVID-19 pandemic prompted their fitting out as intensive care wards in 2020 at a rapid pace, providing an extra 176 beds within 5 weeks. The surroundings of the new hospital are currently undergoing intense change. On the north side of Whitechapel Road, there is the Crossrail project at Whitechapel Station. A life sciences complex for Queen Mary University and Barts Health NHS Trust has grown up on the former hospital estate, focused on St Philip's Church and Newark Street, and modern blocks such as the Blizzard building, located further west on Newark Street. The life sciences campus is set to expand with the recent purchase of several former hospital sites by the Department of Health and Social Care for regeneration and redevelopment. There are also major proposals for the large site between Varden Street and Ashfield Street, where a primarily residential development has obtained planning permission. So, although the Survey of London's project in Whitechapel is now coming to a close, the Royal London Hospital and its estate continue to change and evolve. Thank you for joining my talk this evening. I hope you've enjoyed hearing more about the survey's project in Whitechapel and my research on the Royal London Hospital. For more information about the survey, please do have a look at our website, and if you wish, follow us on our social media channels. Thank you so much for listening, and I welcome your questions.
Thank you very much, Amy, for your talk. It was really enjoyable, and it was really good to hear the fruits of your research. As one of the archives team, we spent quite a lot of time with you over the last couple of years, so it's nice to see that material. Some of those images, I must admit, I've never really even seen myself. So yeah, it was really good. Thank you very much. As my colleague Claire mentioned, I've kind of collated the questions that have come in so far, and if anybody has any more questions, you are very welcome to drop them into the chat. But we'll start with the first question, which came from Miriam. And she asked why there were planned separate quarters for Jewish patients. Was that a request by the Jewish population? I can probably add something to that as well if it's useful.
Oh, that would be great, Dan. Thank you. I can start off. The request for separate Jewish wards did come out of the Jewish community, who spoke to the House Committee and the hospital about having separate Jewish wards. So it was part of a campaign, really.
Yeah, no, I mean, absolutely. And it's probably worth pointing out at this point that that, as Amy said, much of the funding of the hospital was provided through philanthropy, and there were a number of quite significant Jewish philanthropists, particularly who were involved in some of the wards that were explicitly designed for Jewish patients. And obviously, at that point as well, the wards tended to be named after the benefactors. So no, it was very much, I think, something coming from the local Jewish community. I imagine there was some kind of logistical benefits as well, in that the hospital provided separate kosher food and things like that to those patients. The next question came in from Kate, and she said, did the survey's finding suggest that the area around the hospital, but beyond the hospital estate, developed in response to the hospital's own development? So essentially, was the hospital a driver for the development of Whitechapel itself?
Oh, that's a really good question. And yes, I would say so. The hospital really started developing its estate to supplement its income. As Dan said, it was reliant on donations and subscriptions. So developing the estate would create an income, and a solid one, with rents. So it was really sparked by that. There was a lot of concern about the planning of the estate, and doctors and medical staff were involved with the street layout and making sure there was enough air around the hospital. So that's quite interesting. The House Committee minutes are a great source for that and really document the involvement of the medical staff. But the eastern part of the estate, that was developed later because of the priority was west, because it was further away from the hospital.
Thank you.
Thank you.
So Isabel asks, what records might you find in the archives about development of the wider estate, for example, on building leases or by speculative builders? Yes,
there are leases in the archives, and I'm sorry, I haven't included any in the presentation at all. Mason's estate plan from 1855 is a great source. It contains a schedule of leases, and then you can refer to the leases themselves. So there's a huge amount of material. It's really rich, the records at the archives, to help. But added to that, I also forgot to mention Roland Plum produced an estate plan as well in the early 20th century. So, and that has a similar layout, slightly less detail than Mason's plan, but that's something else to refer to as well. But it has a block plan similar to Mason's, and then a separate schedule as well. But no, there certainly are leases that are well worth looking at.
Yeah, and at that point, I'm obliged to say that if you go to our online pages on the Barts Health website, you can find a link to our catalogue where you can conduct searches, and there is also an embedded YouTube video on the catalogue homepage, which gives you more tips, kind of, and hints for navigating your way through it. There's a question here from Dan as well, and he says, was there a favourite item that you came across while researching any particularly interesting photos or documents? I'd obviously argue they're all really interesting, but you might have a slightly more nuanced answer.
Yeah, I'm with you, Dan, actually. I totally agree. It's all really interesting. I think there have been moments of being really excited about certain records, like the schedule of leases and the block plan. That's quite an unusual document. I haven't seen anything like that anywhere else, so that really was exciting. And the Robinson's plan of 1783, again, that was really exciting to find. Yeah, I think I'm just trying to think what else. I mean, there's some amazing photographs in the archives. yeah, I mean, you could just spend hours looking through folders of photographs and just being completely absorbed and barely knowing what time it is. So I think there's a lot of amazing material to get stuck into.
Thank you. I mean, I had a question, and it really regards the kind of the changes of the site over the 20th century. The kind of Plum era feels like a very kind of managed kind of growth of the site, but then perhaps as you get into the further into the 20th century, you see more infill and kind of buildings kind of popping up all over the place, essentially on the estate. Do you feel that perhaps the development was less planned through time and it was more a necessity and reaction to kind of changing healthcare needs, or do you feel that there's a consistency of approach from the hospital in terms of having a clear vision for how the site ought to serve the needs of the kind of local population, of how healthcare is delivered?
That's a really good question. Thank you. I feel as though the listing of buildings on the estate had a big impact. There are amazing drawings from straight after the Second World War for redevelopment plans of the whole estate, which would have been really quite shocking and obliterated so many of the historic buildings on the estate and really changed the hospital. I think for various reasons those didn't happen. I mean, by the 70s, the listing of the hospital was really important and changed design of buildings on the estate. For instance, I think on Ashfield Street, there's an interesting block which continues a row of the early 19th century houses, and it's completely neo-Georgian and by T.P. Bennett, and really at odds with everything else that was designed by them on the hospital estate. So I think there is a kind of a mishmash of buildings later on because of the heritage concerns as well. But no, Roland Plum's work, I think that was a period that really fascinated me in the hospital's development, because it was so it was really energetic. There's a lot of work going on. The hospital was completely overhauled, but then also there was a lot going on the estate as well. So say that was so organized, and I think a lot of that was down to funding. Having the management was very keen to progress their vision for the hospital. Sidney Holland, Lord Knutsford, was amazing at generating funds and very well connected, which really helped. I think after he died, but later in life, he was called the Prince of Beggars.
Yeah.
Because he was so effective at attracting donations for the hospital. But also Plum's personality, he seemed like a very organized, conscientious and diligent man, in the sense that, I mean, there are architects' files at the archives as well, which I haven't mentioned, but Roland Plum's file contains letters talking about, the design of buildings and planning, but also letters saying, please can you remember to bring a ladder with you? And he had this amazing ability to keep up with everything. So I was really impressed with that. And perhaps he was kind of, such an interesting figure and personality. It's difficult to match up to that, isn't it?
Yeah, thank you. No, that's great. Somebody else has asked, other than the Royal London Hospital, what's your personal favourite building on the Whitechapel site and why?
Oh, that's really tricky. I'm afraid I'm really boring as well. It's very difficult to choose one. In White, well, I mean, if you have a look at the surveyoflondon.org website, you'll see there are so many interesting buildings in Whitechapel. Whitechapel Gallery is a really interesting building that was researched by my colleague Aileen Reid, and it's just fascinating. I think for me it has to be the main hospital building, because I've just invested so much time looking into it at the archives that it got so interested in it and absorbed that it's difficult to pick another. It'd be really disloyal.
I was going to say, I'm sure that's the right answer to give on a talk that we're hosting. That's very diplomatic, so thank you. Miriam's asked another question. I've just moved out of Booth House. Was there any connection between the hospital and the Salvation Army? I'm not entirely sure which building Booth House is. Maybe you could help, Amy?
Yes, it's correct me if I'm wrong, but it's on Fieldgate Street, isn't it? It's the block of it's a hostel for I think it's a lovely, I think it's designed, oh, I'm gonna get this completely wrong. Best not say anymore. Oh, sorry, it looks like I'm
so it's the Sally Army Hostel a little further west than the hospital. I mean, I'm not aware of, well, I'll let you speak first because you're the authority, so.
You know, I can't I can't remember a distinct connection between the Salvation Army and the hospital. So, but I'd have to have a look into that and just check that I'm not missing anything from the research.
Yeah, I mean, I'm not aware of a relationship between the Salvation Army and the hospital. I mean, they were both, obviously the London was informed by a similar kind of, I think, by a Christian kind of notion of kind of Christian charity and things, particularly in its early days. Obviously, although it's always provided healthcare to all people, regardless of kind of religious faith or their kind of personal denomination. But I'm not aware of a link. But there may well be an entry on Booth House on the Survey of London website. I'm not sure. It's the
I think there is. I'm sorry. It's just yeah, I'm skipping my memory at the moment.
No. It's I mean, it's a really useful online resource. So I would recommend everybody has a look at it. And it is, even if you're not looking because you've got a kind of a particular question, it's a lot of fun to browse around, and you know, buildings that you've walked past lots of times and thought, I wonder what that building is or what it was previously. So it's a really wonderful resource.
Oh, thank you. It might be worth as well just searching for the Salvation Army in the Barts Health NHS Trust Archives catalogue, and maybe something will come up there.
Yeah, and we absolutely have some material from other hospitals that were closely related to the Salvation Army. So I mean, obviously there were another historically another major kind of component in the kind of I suppose kind of the health and medicine kind of landscape in the UK, definitely. And I think that's all the questions, unless anybody wants to jump in with anything quickly, depending on how quickly they can type. But if not, I just want to thank you again, Amy, for giving up your time to speak to us. It was really interesting. If anybody has any specific questions, is there an easy way they can get hold of you, or any kind of social media kind of profiles or anything that you'd like us to publicize?
Oh, absolutely. You could just send me an email at amy.spencer@ucl.ac.uk. I'm not trying to give you the wrong email address. If you do have any questions, then yeah, no, I'd be very happy to try and help. And the survey is on Twitter, Instagram, Facebook. So do try and follow us there as well if you'd like to. And keep looking out for the Whitechapel volumes as well next year.
Yeah. No, thank you very much. And as my colleague Claire said at the start, this recording will be made available via the Barts Health NHS Trust Archives and Museums YouTube account. So it should be available within the next few weeks for you to watch back. There is also a previous talk in the series from somebody else looking at kind of built environment architectural history, focusing on children's hospitals. So if you've enjoyed this talk, you may well find that talk interesting as well. But thank you again to Amy, and thank you to everybody else as well for taking the time to come along and attend our event this afternoon or this evening. We're very grateful. We have some more events upcoming on different themes, so please keep an eye on our social media, and hopefully we'll see you again at some point in the future. So thank you very much, everybody, and take care.